Tens of thousands of infants get very sick every year from the respiratory virus called RSV.
Yeah, but now there is some new hope in fighting this, right? The FDA has approved a Pfizer vaccine to protect infants in particular.
Yeah, so here to tell us all about it is Dr. Susannah Hills, Assistant Professor of Pediatric Airway Surgery at Columbia University Medical Center. So Dr. Hills, thanks so much for coming in. This really is groundbreaking, isn't it?
Yeah, I'm really happy to be here for this news in particular because every year 50 to 80,000 infants are or children under 5 are hospitalized with RSV. It's a really severe disease. I deal with kids who have really severe breathing difficulty related to RSV every year. Yes, last year was particularly terrible. So now we're going into this next season, right, with a vaccine that we can give pregnant women to protect infants. We have a monoclonal antibody that we can give children who need protection. So we're in just a different place this year, I think, entering into the season.
It's comforting.
Let's talk about, first and foremost, the new injection given to a pregnant mother before the child is even born, because this is incredible and such a breakthrough here to protect the child once they're born, because you hear, the babies can't get their vaccines for the first couple months. So how is this going to work?
Right. So we give it to pregnant women at 32 to 36 weeks of their pregnancy. And when the baby is born, it gives protection from the virus for about 6 months. It provides an 82% reduction in disease in the first 3 months of the baby's life. And then that protection wanes a bit, but it continues giving protection for at least 6 months after the baby is born. And this is really important because infants, when they're born, really don't have a developed immune system for the first 3 months of their life. So this is covering them with really excellent protection for that 3 months when they're really vulnerable.
So talk about why it's so critical to protect babies from RSV.
Well, every year when I have kids with RSV show up in the emergency room, there's a whole spectrum of problems they can have, but it ranges from, noisy breathing and struggling a little bit to really needing potentially a breathing tube and a ventilator. So it can be very scary for parents. It can be very serious for children. Children who are at high risk for other illness, but even regular kids who have no other medical problems can get very, very sick with this disease.
Yeah, I was panicked by it last year because I had an infant. She was only a couple months old going into the RSV season when it was peaking and couldn't get the vaccine because she was too young. So talk about now what the options are once a child is born, when they can get the vaccine now that it's FDA approved.
Yes. So this vaccine is for pregnant women, so that will provide immunity early on. And then there's a vaccine that is available for children. We're talking with pediatricians now, recommending that parents talk with pediatricians about how at risk their kids are. They're available for children up to 9 months of age, generally speaking. After that, from 9 to 18 months, it depends a little bit on the child's risk factors, whether or not your pediatrician will recommend it. But we have an option now from 9 to 18 months to
And that's new.
Yes, we have another vaccine that was available that that provides protection, but it requires a monthly dosage. This vaccine will provide protection for the entire season now.
Wow.
So it's really a longer lasting option. You don't require the monthly injections, and it's really open for a wider group of patients, a wider group of children early on in life.
Well, considering what happened last year, how has this affected your office? Are you already getting an influx of parents calling?
So not quite yet because the news is so new, but I think it's going to be a really important conversation for pediatricians to have once the RSV season starts, and it's coming up. So as we hit the school year and kids are getting exposed to more viruses, they're going to be bringing viruses home to their younger siblings. Getting children protected is going to be a conversation to have really start having now and early in the fall.
The shot for the pregnant women, that is still waiting a final approval?
The FDA has approved it. The CDC now has to give their recommendations on who should be getting it. But right now, it's approved for 32 to 36 weeks gestation for pregnant women.
Gotcha, okay. Any timeline for the CDC?
We'll see.
Yeah,
not that I'm aware of yet. So we'll see, hopefully soon.
But before we let you go, can we just talk about the basics of RSV and how to tell the difference between that and whatever, maybe a common cold or the other symptoms that you would think is just part of the season?
Yes, so that's a great question. And it can be very much like a common cold. So many people will get RSV. They'll have a bad cold, runny nose, cough, those kinds of symptoms that we all get. But the problem with RSV is in a small airway that's really narrow. It causes a lot of inflammation, and then children can get noisy breathing. It sounds like a whistling. They can struggle to breathe, retractions, and they can really start struggling to breathe.
Right.
That, to me, is really the difference with RSV and a cold. You'll get lower airway inflammation and struggling to breathe.
Yeah.
And the same thing can happen to older adults too, in particular, because over 65, your immune system is lower. You're more susceptible to problematic complications from RSV.
So many things to talk about between RSV, the flu season,
Yeah.
COVID-19 vaccine shots as we head into the fall. So much to talk about, so we're going to have you back, all right? Appreciate you being
great.
here. And Susannah Hills from Columbia University Medical